I think that at the foundation of who I am, it's my faith in God, and I believe that serving God is serving others. So seeing real improvements in patients' lives was always energizing for me and kept me from getting burned out.
After getting his start at Des Moines University, Dr. Gary Stuck officially retired in 2024 after decades serving patients.
I knew that I wanted to be a physician when I was very young. I think my parents must have been whispering in my ear in the crib or something, because by age 5 I was bound and determined I wanted to be a physician. And so I was pretty focused.
Stuck found his way to DMU after earning undergraduate degrees in biology and psychology.
And I did see that DMU was really focused on strong clinical experience right out of the gate, and also just getting you comfortable talking with patients and developing your skill sets with emotional intelligence and compassion and thinking about putting the patient first in everything that you do.
Gary moved to Des Moines with his wife Pam, who was just beginning her own career in nursing.
We married right when I graduated in 1981, that summer, and I started my first job at Iowa Lutheran. I started on the PM shift, and Gary was busy with his schoolwork, so it was a lot of working, but we were happy. He has been my rock for 43 and a half years, and I am so happy and proud.
One of my really fond memories at DMU was my graduation day, and that was in 1983. And my father was a member of the clergy, and he was asked to give the invocation at the graduation ceremony. It was a really proud moment for our family.
After graduating DMU in 1983, Stuck completed his family medicine residency at Rush Presbyterian St. Luke's Medical Center in Chicago and practiced family medicine for over 3 decades. He was recognized as the Illinois Family Physician of the Year by the Illinois Academy of Family Physicians in 2014.
I was working long days as a family physician and loving every minute of it, and I really found the value of those long-term relationships and the incredible honor that it was to have a patient put their complete trust in me to serve them.
Continuing to pursue leadership opportunities, he eventually became Chief Medical Officer of Advocate Health, the nation's 3rd largest nonprofit health system.
Which forced me to pivot out of the career that I loved, taking care of about 2,000 patients, and then feeling responsible for about 6 million patients. And I think it reinvigorated my purpose.
He may be retired now, but that doesn't mean he's slowing down.
It's very important that all of us, no matter where we fall in our careers or whatever success we get, that we don't forget where we came from. And so that creates a responsibility to give back. And that means not getting paid for everything that you do. It means sometimes getting out of your comfort zone. And I love mentoring other physicians and physician leaders, and I'm doing some of that in my retirement. So I find that very energizing and love that work. It's not work, to me, that's fun. I have so much respect for DMU. I know what it did for me in launching my career, and I know what it can do for the students, current and future. I was so well prepared to go into residency. You know, being a physician is lifelong learning. But if you have a really strong foundation and you go into a challenging residency or a challenging environment, you have the tools to navigate and to hold your head high and feel really confident. I'd really like to thank DMU for what I was given as a student and the support that I had.